It seems we lose the game. Maybe we're so tell you that possibly from deficit against Baptist and violent from the beginning. My practice is getting across the axis. I be gases, flipping in together on the dirty mattress. You can't match this. Rapper slash actress, more powerful than two Cleopatra. Bomb could be on the tomb of Nefertiti. MCs ain't ready to take it to the Serengeti. My rhymes is heavy like the mind of Sister Betty. Boogie sparks with stars of constellation. Then came down for a little conversation. Adjacent to the king, fitting on human beings. Go with cherubims to that sort of conversation. Now hear this mixture with hip hop meets scripture. Develop a negative into a positive picture. Everything when the loss comes straight, change comes eventually. Sometimes it seems we'll touch that dream, slow and not alone. And the ones on top won't make it stop. Don't give it the day might fall. Love ourselves and we to make a better situation. All we need is dedication. Let me tell you, everything is everything.
Okay, I think we're ready to start. Welcome, everyone. This is Algene Sajery. I just wanted to welcome you to today's uh, panel discussion, a fireside chat with some esteemed guests. And first, we'll kick it off here in a few moments with an introduction of Congresswoman Barbara Lee. Feel free to share where you're logging in from and say hello to people you recognize in the chat.
Stop pencil. I scribble the stanza as my hands are trembling. Racism made heaven out of words. I began to build a world that only I inhabit. I gotta have it. It's everywhere challenge. I think I'm too passionate. Trying to steer the way while in the dark. Hope I ain't crashing it. Got my little hockey turn to cash now. Thinking about who I be if I listen to doubt. Did I never do it? Well, look at me now. Young girl, oh dream, oh song, oh dear. Plan B, plan well, the love, the fear. Just wait and God will tell you when the time's near. But if I never jump, then I die here. Don't ride till you pick up speed. They think college is all you need. And I don't blame you brainwashing on you, G. It took me 19 years to finally start to believe. And it's me, listen. I'ma make it rain or shine. All about my money, don't ain't no.
Okay, guys, let's get started. Welcome to the Global Health Council Summit. I'm Algene Sajery from Catalyst Global Strategies. It is my honor to introduce a living legend in the global health community. She really actually needs no introduction. She's a former Hill staffer, small business owner, social worker, California state legislator, and political organizer. Congresswoman Barbara Lee has always made good trouble. Since her time in the California legislature, Congresswoman Lee has been a fierce advocate for ending HIV and ensuring an AIDS-free generation in our lifetime. Since entering Congress, she has authored or co-authored every major piece of HIV/AIDS legislation, including the legislative frameworks for PEPFAR and the Global Fund. Congresswoman Lee's legislation establishing a USAID Special Advisor for Orphans and Vulnerable Children was also enacted into law in 2009. In 2011, Congresswoman Lee formed the bipartisan and bicameral Congressional HIV/AIDS Caucus, which she co-chairs. Currently, Congresswoman Lee serves on the Budget Committee and the powerful Appropriations Committee, which oversees all federal government spending. Congresswoman Barbara Lee is the only African-American woman in Democratic leadership, serving as co-chair of the Policy and Steering Committee. In addition, she currently serves as the chair of the Majority Leader's Task Force on Poverty and Opportunity and co-chair of the Pro-Choice Caucus. Although she couldn't join us today live, I want to just say thank you to Congresswoman Lee for recording this pre-recorded message for us today.
Hello, I'm Congresswoman Barbara Lee, and I represent California's beautiful 13th Congressional District located in Northern California, where the cities of Oakland and Berkeley are located. I want to thank the Global Health Council for inviting me to speak at this year's summit. Your title for this year's event, Pandemics, Politics, and Privilege, it truly is a fitting one because all three have fundamentally changed our society in America but also throughout the world. As a founder and co-chair of the Congressional HIV/AIDS Caucus, I continue to work with my colleagues on addressing HIV and AIDS domestically and globally. Our fight against HIV and AIDS here at home cannot be divorced from the global effort. From the beginning, the HIV activist community in the United States saw echoes of their own trials in the African struggle against HIV and AIDS. 20 years ago, I helped create the legislation that led to the Global Fund and PEPFAR. Since then, I have continued to fight hard to ensure that our appropriations bills have robust funding for HIV and AIDS, and that we have a national strategy that will allow us to diagnose, treat, and prevent and respond to HIV and AIDS to reduce the number of infections. We will see an AIDS-free generation by 2030. I have been encouraged by the evolution of PEPFAR from a pure emergency response program to one that is focused on supporting country-led efforts to strengthen health systems and build local leadership. The bulk of the credit is not ours, though. It goes to the community leaders who have worked to improve the health of their own societies and neighbors. But I am proud of the United States' 2 decades of work as a partner, encouraging local initiatives and providing the resources necessary to drive success. There is so much more to do. And there is evidence that these efforts have driven durable change. Like many of you, I have been raising the alarm for most of this year about the need to provide assistance to African countries during the COVID pandemic. And yet, 2 decades of investment and partnerships with African countries on public health has contributed to a qualified success in controlling COVID, successes such that we need to now ask, what can we in America and throughout the world learn from Africa in the field of public health? It is time we look to our African partners to provide solutions to the rest of the world, including the United States. And yes, as we look to the future, we must now recognize that each investment we make with our global health support needs to ask not only what we can teach, but ask what we can learn. In reimagining the future of our global health programs with a stronger focus on equity and justice, this reminds me of the basic fact that Black Lives Matter, which some, not all, but some are beginning to realize. We must not only say this, but target resources to those most impacted. In the United States, every policy and program, including global health, must be viewed with an added racial and ethnic lens. We must regroup and fight to dismantle systems of systemic racism and increase our advocacy to repair the damage of the past. With the horrific COVID pandemic in the United States and in many countries, we see inadequate healthcare systems that have been discriminatory, leading to disparities which have led to immoral rates of transmissions and deaths of Black and brown and marginalized people throughout the world. We must no longer tinker around the edges with reform measures, but tackle the healthcare systems and structures at their very core. In many countries, including in the United States, we should participate in peaceful protests as advocates and not dodge politics anymore. We must be bold, think out of the box, and build a domestic constituency for global health programs. We must participate in elections and let those know who are making decisions know that there is a power shift and the privilege can no longer run the show, because we have built power with those and by those most impacted by these decisions. So be bold, be visionary, and increase your efforts at intersectionality. If we do this, the privileged will understand that this is a new era. The old ways just won't work anymore. Thank you again for inviting me to speak with you all today. I look forward to continuing our work together in challenging the status quo and building transformational initiatives that will finally have justice and equity at its core. As my friend, a great woman warrior, Congresswoman Ayanna Pressley from Massachusetts reminds us, those closest to the pain must be closest to the power.
Wow, that is quite an inspirational message. We want to thank Congresswoman Lee for sending that important message to us today. And to continue our conversation, we are joined by three very special guests for this virtual fireside chat. We have Mr. Travis Atkins, Kaya Lewis Atkins, and Dr. Sayan Firu. I'm just going to read through their bios very quickly. Mr. Travis L. Atkins is a lecturer of African and Security Studies at the Walsh School of Foreign Service at Georgetown University. As an international development leader, he has 2 decades of experience working in governance, civil society, and humanitarian affairs in over 50 nations throughout Africa and the Middle East. This includes serving as staff director of the House Subcommittee on Africa, working with leading international NGOs and think tanks, as well as within several branches of the United Nations system. Travis is an alumnus of the International Affairs Fellowship at the Council on Foreign Relations, an Aspen's Ideas Festival scholar, and a recipient of academic appointments from Carnegie Mellon and New York universities. Mr. Atkins has served in numerous international election observation missions in Africa and the Middle East with the National Democratic Institute and is the creator and host of the On Africa podcast, which engages diverse thought leaders in conversation on the continent's politics, history, and culture. Kaya Lewis Atkins is a domestic and global health policy and programming professional with over 20 years of experience providing leadership, program management, advice, and analysis in government, NGOs, and foundations. She has extensive experience collaborating and negotiating with high-ranking members of governments, multilateral organizations, NGOs, and donor entities. Her professional interests and expertise include the Affordable Care Act, domestic and global public health, HIV/AIDS, women's health and reproductive health, health disparities, and community advocacy and capacity building. Currently, Kaya Lewis Atkins is the Senior Technical Coordinator for AGYW at the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Dr. Sayan Firu is an emergency physician, an assistant professor of emergency medicine at Columbia University in New York, and an advisor to the Ministry of Health for the Federal Democratic Republic of Ethiopia. In her role at the ministry, she supports and oversees several programs, including emergency care capacity building through training and research, emergency preparedness, and the response of Ethiopia's Public Health Institute to mobilize resources with initiatives to assist in the attainment of Ethiopia's health sector transformation plan. At the ministry, she established a women's leadership forum for all management and executive committee leaders. She created a platform for both men and women to engage in dialogues of tackling gender-based violence and implicit biases in the workplace. These dialogues have helped inform both men and women on how to build a gender-sensitive environment and how to foster women leadership within their institution. So I want to thank our panelists today. And to kick off this conversation, I'm going to start with Dr. Firu. And so Congresswoman Lee, her inspirational message talked about and quoted Congresswoman Ayanna Pressley by saying, "Those closest to the pain must be closest to the power." Given your role as an advisor to the Ministry of Health in Ethiopia, what U.S. government partnership engagement strategies with in-country stakeholders would you say have worked well? And what gaps or challenges persist?
Thank you for that question and also for that inspirational speech. I absolutely agree with the saying those people closest to the pain must be closest to the power, because it resonated with me and my colleagues who had been at the front line. And if the people at the decision table were at the national level, like we've seen here in the US, unfortunately, would not be where we are right now. And it doesn't reflect the people that are affected disproportionately. You've seen the task force that we had for the past year, and hopefully that will change, and that's changing. But unfortunately, that's not been the case in the US. And with some of the things I would say in Ethiopia, that Ethiopia is not only just the COVID task force, but we have a gender balanced cabinet, and also the leadership. We have women minister, and also specifically, if you look at the COVID task force, it's been well represented by healthcare professionals. And when you talk about healthcare professionals, not only about like doctors and nurses, but healthcare workers that are out in the community that know the country and the population very well have been represented on the decision table and the dialogues with the people that are making the decision. In regards to your question about the partnership with the US government in Ethiopia, some of the things that worked include not just only with the COVID, but really identifying the in-country gaps for the provision of care, whether it's for the COVID task, for the COVID response, or for provision of care for HIV, TB, malaria, and other things, has been really identifying the local gaps and asking the US government and other funders to support those programs. And that's so important also because we don't want things just to be very vertically approached and just ticking down the boxes to help the countries, because it really doesn't work. It has to be a country-led. And also investing in capacity building and institutions that would enhance the capacity building in the long term, just not short term whenever we have a program or funds that are available. So, you know, when the people pack up and leave, we've seen how programs fail, such as HIV programs um, and malaria programs. But if we build institutions and also help the local capacity, I think in the long term, it could have an effect. So that's one of the things that has worked in Ethiopia very well. Some things, of course, the gaps, as we know, some of the decisions that happen at the US level are really politically driven. With each administration's things change, such as the global gag rule, which unfortunately blocks access to healthcare and stifles the local advocacy efforts and undermines reproductive rights worldwide. And really, the pro-choice and the pro-life discussion should not be happening at other country level. Of course, for whoever's at the decision table for this country, that can come up, and that's why we have the Congress and the election process for that. But unfortunately, we see that trickling down to other parts of the world, which should not be the case, because US solutions do not necessarily work for other countries. The US solution is not going to work for Ethiopian solution, for Rwanda solution. So I think it's very important that people really gear towards the problems in the country and find the local solutions and not be politically driven. Countries who've been bold about their ask and request, like Ethiopia and some other sub-Saharan African countries, it has helped in really engaging and also trying to focus onto their gaps, onto their problems that they have at hand. Other things that we've seen, not only with the US government, but a lot of donors, most programs are very vertically driven, and unfortunately that is not going to help with the capacity building in the long term. Yes, we've had great, and I have nothing against TB, HIV, malaria programs that we've gotten through the PEPFAR, but as you've seen now, as the global burden of disease changed from infectious to non-infectious and like non-communicable diseases and injuries, which is affecting many people around the world disproportionately, especially the young, the fruit of the nations of many countries in Africa, those programs are not being supported. So I think just in general, we really have to advocate to focus on the problems affecting the countries, not really what out of goodness or out of the availability of the funding should not be directing or changing the agendas, but really what the countries want and what the countries have prioritized should be supported.
Absolutely. I fully agree that we need to look at the country's recommendations for what needs to be done. We have to come up with local solutions, and the US should take a partnership approach to our development programming and our global health programming. So I want to actually speak to Kaya next, because Kaya, you have a really very diverse background, having worked at the Office of the Global AIDS Coordinator at the State Department on PEPFAR, and on the implementation side of a PEPFAR funded program in Zambia, as well as a Swedish government global health program in that country. And you recently started a new position at the Global Fund in Geneva. Given your diverse experience as a US policymaker, in-country implementer, and now at a multilateral donor secretariat, what lessons can US government global health agencies and offices learn from the Global Fund's country coordinating mechanisms with respect to promoting equity and inclusion through those country-led initiatives and implementation processes that Dr. Firu was just speaking about?
Hi, can you hear me now?
Yes.
Okay, great, thank you so much. And such a great panel, and I'm always so inspired by Representative Lee. Communities need to be at the center of what we do. And what I loved about what Representative Lee said was something I've always believed. We have so much to learn from each other. And whether it's the US, whether we're in Lusaka or Los Angeles, whether we're in Botswana or Baltimore, the people that we're trying to serve need to be at the center of what we do, how we shape our programs. And it's our proximity to them. Brian Stevenson talks about proximity. It's being proximate to the issues that helps us create programs and policies that help people. And so the Global Fund is based on 4 principles: partnership, country ownership, transparency, and performance and financing. And so country ownership and partnership is how the Global Fund is set up. Our country coordinating mechanisms are there to make sure that countries have the agency and the power to create what programs work for them. We have communities that are a part of our board, civil society and other community constituencies that are a key part of our model. And so we understand that the fund, and I have seen through my work at every level, whether domestic or global, that we have to have communities at the center. I'm now working on adolescent girls and young women's work, and we all have to work around the world to make sure that girls and women are a part of creating the programs for them, especially around HIV and other really challenging health issues. They know what works in their communities. They know what will help their peers. They know what will help their families. And we have to listen. So I'm pleased to be a part of the Global Fund, but also pleased to have, over the course of my career, whether in Zambia or at home, worked with communities to help create the solutions that we need.
Amen. And I mean, I believe that with whatever we do and all of our foreign assistance and even our domestic assistance, it all has to be community-led and there has to be a community focus. So I really agree with that. And then following up on that question, Kaya, Representative Lee issued a real call to action, right, for the global health community to be bold and press for transformational policies and programs like PEPFAR. So as we all know, our community includes multiple stakeholders, donors, implementers, policymakers. From your perspective, how is the donor community charging stakeholders to be more bold and transformative in their approach to global health programs?
Yeah, I think the wonderful thing about having a variety of donors, whether it's such an important donor in the global health space as the Bill and Melinda Gates Foundation, and one of the biggest private donors to the Global Fund, or whether it's governments and other government donors. I've worked with the Swedish Development Agency, and they're an influential partner on the Global Fund, and in fact just one of the ways that they're pushing forward, they gave some dedicated money to go towards adolescent girls and young women work on helping to integrate sexual reproductive health and HIV work. This idea of having integrated programs, especially for women and girls around issues of HIV and SRHR, is so important, especially in settings where people really don't have the wherewithal to go to two different places or even two parts of the clinic. Right. So pushing those ideas around integration forward, being on the cutting edge of technologies that can really advance our agendas. But then there's other things like the ACT accelerator. Right now we're facing COVID and trying to figure out how we can use the platforms that we have to address that pandemic and not lose the strides that we've made with the HIV and AIDS epidemic. And so innovative ideas like that are then supported by international organizations as well as donors really help to push the ball forward. I think oftentimes donors are able to be nimble in a way that sometimes governments can't or that international organizations can't, so that they really can be bold, and because of their voice and because of their influence, they're able to help organizations move forward, whether it's by supporting staff, supporting for us, there's some donor support that goes to country coordinating mechanisms to make sure that our communities are capacitated to be able to shape their Global Fund grants and programs on the ground, or to build the capacity within partners on the ground, knowing that having them equipped to do the work is going to be what makes difference in the end. So I think donors just can really push the envelope and bring organizations along, and sometimes really help organizations to go where they want to go, but sometimes have to move a little bit slower because of governance structures. I think donors can really help push the agendas forward.
Absolutely, I fully agree. And one thing that the Global Health Council has put forward is their new bold initiative, right? The new agenda for global health, the new vision for global health. And, they used to call it the big idea, but it's a new vision, and it's something that they're proposing to the US government, folks in the US government that are, at the helm of our global health programs, to really think about how we can be more nimble, more bold, push the envelope, and kind of loosen up some of those strings that are constraining our programs from really being as transformational and bold as possible. And so I implore everyone to kind of take a look at that new vision document. Travis, currently, the Democratic and Republican parties are extremely divided, right, on a broad range of national issues, including COVID-19 and the crisis here. We just talked about the need for the US government to be more nimble, more bold, and the big idea, right? And all of these things that the Global Health Council and the membership have put forward are wonderful and important things to do, but they take a little bit of flexibility, and they take Congress. So if both parties cannot agree on a national plan to combat the virus and economic downturn simultaneously, how can we ensure, and what can the community do to shore up bipartisan support for global health priorities? Right now, we want to make sure that they are more bold, more transformational, and equitable. What can we do?
Yeah, absolutely. Thanks for the question. I think one of the things that comes to my mind immediately is that, for this entire year, or for the lion's share of it, all of us have been asked to be wary of exposure and to avoid exposure at all costs. But I think those who cannot avoid exposure in a time like this, in a metaphoric sense, is our government, are our public health officials, are those who are in leadership. in Congress and elsewhere. And what we're finding out now is the difference between those who believe in science and those who don't. Those who will advocate for public health and those who will decide that misinforming for political gain is the best way for them to go. Those who think that consumerism and the economy is more important than the lives of human beings. And so I also resonated with the words of Barbara Lee and Ayanna Pressley. And I had the great misfortune actually of losing my own grandmother to COVID just on Sunday night. And so when you talk about hitting home, certainly that club of 250,000 people that we'd rather not be in, and we are because of this failure. And I think it resonates in a specific way in terms of global health, because in my thinking about this, it's an opportunity really for a hard reset, because I think that we're fooling ourselves if we think we can be someone abroad that we are not at home, right? How can you be bipartisan about global health if you're not bipartisan about domestic health? And how do we say that we are world leaders in the way that we want to be aspirationally, right? Because right now it actually is America first, and we are a world leader, but we're first and a world leader in the number of COVID cases, in the number of COVID deaths, and that's not what anybody hoped to be the truth of reality when we made those statements. And so I think it's incumbent upon us, as Representative Lee pointed out, and we've seen people in the streets protesting this entire year against various issues, whether they be migration and immigration related, whether they be related to injustice, economics, climate change, and the like. And I think that COVID really has exposed all of the fissures and the huge gap between who we say we are and who we actually are. And we can either say that, okay, we're destined to be this kind of failed state, not in the global sense, but in the sense that we are not able to meet the mandate to protect our citizens, or we can say we want to build this thing back better than it was before we considered ourselves to be in normal times. And so I think those are some of the considerations that have to be made as the new Congress comes in, as the new administration comes in, and a continued encouragement to civil society actors and global and public healthcare workers on the front lines to continue to raise their voices.
Yeah, absolutely. And first, I want to just say my condolences. I unfortunately know what you're going through. I lost my aunt to COVID in March, and I'm sorry, in May. And my hearts and prayers go out to you and your family. And Dr. Sion, as Travis so articulately conveyed, the U.S. has really struggled with its own COVID response. And how have U.S. domestic response deficiencies, right? Let's just call them deficiencies, changed how the U.S. is perceived by our African partners? How has this change in perspective impacted our joint work on the ground, if at all? And what should we be doing now to recover?
Thank you, Algene. And I also want to pass my condolences to Travis and to you, to Algene. It's been something that I've witnessed here in New York, and there are so many stories behind the numbers. I think when we see the numbers every day, people kind of, especially when it doesn't hit home, people forget. And I'm sorry again for your losses. To answer your question, Algene, I think the approach had been really to say, learn from the mistakes of the US. Do not rush to open up the economy. Do not politicize the response. It's not a matter of just a Democrat, Republican. It's not a matter of rich or poor. It will affect everyone. And I will tell you, as an advisor and somebody, people know that I do live between New York and Ethiopia. I've been challenged based on the responses and from the US. And I might be biased as a New Yorker. I say, but like, look, New York is a different thing. Look how we've actually bent the curve. We were hit the hardest. So there's something to offer, and just look at it from state to state. And as New York has the one of the hardest hit areas, it did bend the curve with the implementation of the non-pharmaceutical interventions, right? I myself always talk about how when I felt like we were drowning in our emergency department in our hospitals, that the second that the governor and the mayor took that decisive action, we just saw how it took so much of the burden away from us. And now, as we prepare for a second resurgence, I don't like to call it the second wave because as a country, we're still in the first wave. I think people do forget this. And as we prepare for this, and New York City just closed down the schools today, and it's causing a lot of uproar. Like, do we need to close the schools before the bars and the restaurants? But there's just really trying to share the lessons and the experiences from New York, but that really should just focus and say, hey, like we should not be doing what the rush to reopen the economy, which is what we've seen in Ethiopia and other sub-Saharan African countries. And as far as what the future holds, and I think the U.S. can definitely reclaim, unfortunately, the leadership in global health that has been lost with this current administration. But it's not a matter of just taking and reclaiming the leadership, but it's also amplifying the voices from global south. As we've seen, global health in general has been really dominated by people from the global north. And we have to move away and change the narrative. Just like I said earlier, the people on the decision table, the people that are advocating at a higher level, need to resemble the same people that we're trying to serve. Sometimes when I walk into this global health meetings, I can't tell if I'm in like an orthopedics grand rounds versus in a global health discussion because everybody on stage is white, middle-aged, gray hair, and that should not be the case, both for orthopedics and for global health. But I think we've kind of learned to accept certain things, but absolutely not accept them in global health. And I'm really looking forward to what the next administration will do, as some of the measures that could be taken to reclaim the leadership in global health is to, of course, rejoin the World Health Organization, um, and repeal the global gag rule, and also to support programs and organizations that aspire for global health equity. As we know, some of the USAID money had been halted to anything that works on reproductive health, whether it's abortion or not, had been drastically reduced in the past few months. So these things will change. And when it comes to COVID, whether it's here, whether it's in Asia or in Africa, it just has to stop. I don't know if I personally have the bandwidth and the strength. I'm exhausted. I do not want to go through another resurgence again. But unfortunately, with the holidays that are upcoming and the numbers that are highest record every day and the deaths, I think I feel, my heart goes out to everyone and that's suffering, especially the healthcare professionals in North Dakota and South Dakota, without the support and the leadership of their governors and their mayors. And hopefully this would be a national thing come January 20th, and that the division across the political lines hopefully will disappear. And it will take years. It's not a matter of just months. The health inequity issues that we witnessed from COVID, it's been a setback for everyone, not only in the US, all over the world, everything that we've met. But I think at this point, what we have is hope and really to work toward that. Thank you.
Thank you, Dr. T. We have so much to unpack in just what you just said. I'm so glad that we do have the breakout sessions so that GHC members can sit and really reflect on this conversation and sort of unpack some of that. So much there that you just said in that response. And one thing that the GHC is proposing, this bold new big idea, which includes equity, right? Which includes an opportunity to address these injustices and these inequities. And so I think that's really critical. You mentioned multilateral institutions, you mentioned WHO. So I want to pivot to Kaya, since you're currently at a multilateral, you're at the Global Fund, Kaya. And I know that there has been talk by some certain US actors about multilateral institutions like the Global Fund, like Gavi, as sort of a workaround to older models like WHO. Your organization has led on aspects of COVID Response Act, COVAX, and has been a model for tackling major global health issues, right, in very innovative ways. What's your response, though, to some US stakeholders sort of wanting to color outside the lines, if you will, with respect to its partnerships? And what are the risks of such an approach? And in your view, how should a President Biden walk this line when he takes office next year?
Good question. I mean, so let's be clear. I mean, first of all, the Global Fund has been around over 20 years now. So maybe it's new, but it's not that new. And an institution like the WHO, I think people need to get outside of the US to understand what the WHO means to the world. And every institution has its challenges. Institutions go through change, they go through restructuring. That's needed in every institution. But the fact of the matter is that the WHO is set up to be a place that has normative guidance for the world. And from working in the field, and anyone that ever has, knows that you really can't move things forward unless countries know that the WHO has put their stamp on it. It's the WHO and their Ministry of Health. And it doesn't really matter what anybody else says in the end. It's not going to go anywhere. And so I think I'm looking forward to the United States re-engaging in the global health community and re-engaging with WHO. I'm very hopeful that that will happen. And I think that we need to innovate. We always need innovation. We always need to push, but we need to realize the institutions, mechanisms that are set up. And, when it comes to the Global Fund and other international organizations, we work with the WHO. The WHO is one of our key technical partners. We're not working around them. And so I think we need to continue on that path. We can always improve. And everybody has their comparative advantage. Each organization has their specific groups that they have the most influence over and the way that they're able to work best, whether that's PEPFAR, the Global Fund, WHO, other organizations. So I think we need to figure out how we work best together and do what we need to do to support each other and push each other when change needs to happen, for sure. But creating parallel structures or new workarounds to deeply tested, tried, and institutions and relationships, I think isn't particularly wise. And so I'm hoping that the US can re-engage with the WHO properly, and that we can continue to work with them and with our other technical partners in the way that we always do, to try to make sure we have good evidence-based solutions for the people we're trying to serve.
Absolutely, really critical analysis there too, and good advice to the incoming president of the United States. And I really, again, want to make sure that we talk about this issue in the breakout session next. Travis, you have a bird's eye view of the core issues across the sustainable development spectrum, including health, right? So how can we, when we're talking about being integrated, not vertical, horizontal, making sure that, someone can get from one place of the part of the clinic to another to get a different service, how can we align our health programs with those priorities sort of on a broader level? like gender or economic empowerment, and take a look a more integrated or horizontal and comprehensive approach to U.S. aid programs. And what are the pros and cons of this horizontal approach? In other words, is there a case to be made for ongoing health exceptionalism in the time of COVID, or have we run out of runway there?
Well, the first thing I would say is I would readily associate myself with everything that Kaya just laid out for us overall and specifically as it relates to the incoming Biden administration. The next thing I would say, specifically in terms of re-engaging the world, obviously we're going to have a very hard time preaching to anyone about governance, about global health leadership in this new administration. And I think that this is an opportunity for really an attitude shift, right? Because the position that we've been in, the posture that we've taken, has been more about teaching and leading, I think, than it has been about supporting, learning, and understanding. And what we're seeing in places like Africa and other places in the so-called global South are nations who do have better numbers than ours, who have managed to outperform Western nations as it relates to addressing this specific crisis. What can we learn there, right? Did they just get lucky? Is there another shoe that's going to drop, as so many journalists have been writing about? Why haven't we seen more death in Africa and these other places? And so looking at that, and then I think, for all of the global health professionals who are here, you all will know better than I the kind of powerful kind of outcomes of PEPFAR and other initiatives in terms of kind of global healthcare system strengthening and that infrastructure that is there. And so do we have an opportunity legislatively and through the executive to expand those kinds of programs and those kinds of partnerships? I think the other thing is for all of us, and I don't really have to give that reminder to this kind of an audience, but that, typhoid and cholera and malaria, like they're not in Jamaica hanging out, right? They're still killing people. They're still wreaking havoc, and we still have heavy disease burdens in other sectors, even as we deal with a crisis like this. And so I certainly believe that the time of healthcare exceptionalism has run out, if there ever was grounds for such a claim. And I do think that for us, the time is out for kind of being above everyone else and in a position that we have arrived, and realizing that we're struggling just like everybody else to figure this thing out and to protect our people, and to know that it's called global health for a reason, because it is in fact a global concern.
Absolutely. It's called global health for a reason. It is a global concern, and it's something that, these things, pandemics don't end at borders. And we need to really be very coordinated moving forward. And to wrap up this conversation, we only have about 8 minutes left. I want to ask a question to you all. As I said, Global Health Council has put forward this big idea that we're proposing. And I know all of the various working groups and community members and organizations are looking at what their recommendations are for Congress, for the global health community, for the new administration and the 117th Congress going into 2021. And so I want to just ask, what are to everyone, what are your top 3 most pressing global health programmatic and policy priorities that you believe the next administration, the 117th Congress, the global health community as a whole need to tackle within the first 100 days of 2021 and beyond? I know it's a lot.
I guess I'll go first. Really quickly, I mean, COVID.
All day long.
I know everybody else was going to say that also, but we honestly, truly must address that in an organized, competent, integrous, and moral fashion. And I think there are so many dedicated public servants that have been trying to do that and have not been able to. And so I am sure that the Biden administration will do this differently, do it better. It's going to be hard. And I would just really emphasize, we've been talking about communities, this, of having vaccinations are good, getting people vaccinated is what is going to make the difference. And that will not happen unless we reach out in the right ways to the right communities. So that's number one. Number two, re-engaging with the global health community. And I have to say this for me, and from what I've learned from my work and what I'm doing at the Global Fund now, the plight of women and girls around the world is tough and difficult and sometimes heartbreaking. And I think placing women and girls in the center of what we do in the global health community, it's definitely one of the keys to making sure we get control of the AIDS epidemic, but for so many other things as well. And so I'm looking forward to the policies that have prevented us from doing that in the recent past being overturned, and for the right focus on women and girls in global health to be a part of what we see coming out of the administration. Over.
I'll go. I think most things I said earlier, and Kaya, most of us surely reiterated, but I think the U.S. has to lead by example. It can't be a hypocrite nation, and it can't definitely be preaching what's not practicing, right? So one thing I would say is I think all of us as a nation, the US and all over the world, should really work towards UHC, universal health coverage. And one of the things that hopefully won't happen is at this point is, ACA is the way towards universal health coverage. So the next administration, especially Congress, hopefully would not repeal the ACA. That's prioritizing that comes with really addressing the health equity issues. And we'll see that right now more than ever, right? I'm seeing now in my emergency department, people that have lost their insurance that can't afford their medications and coming because they need an insulin injection or because they need their medications refilled because they don't have access to primary care anymore. So with the economy, some of the economy downfalls that we'll see in the upcoming few weeks after COVID and during COVID, it comes with a lot of health consequences, not on the direct, but also the indirect effect of COVID. So I think really trying to advocate for universal health coverage and start statewide. It doesn't really have to be at a national level. We can learn from the states that have achieved it already. And I think with that, and if the US starts with, most of the European nations have done, I think it could be an example for many across the world. And the other things that I've said is really hopefully to rejoin the WHO and focus on multilateralism. It is very important. Dr. Tedros always says it, it's really important. Solidarity is the way to go. And I always quote this African proverb, if you want to go fast, go alone. But if you want to go further, go together. And I think it's one of the things that we should do as a nation. And Kaya had already put it beautifully, but I think it's important to amplify the voices of the minorities and the most vulnerable and to put them at the decision table at this point, which are mostly women, put them at the decision table and different leadership positions, either here or on many global organizations. And like I've said, when I walk into a room, and I always challenge my colleagues here and in Ethiopia, if I see just men sitting around the table, I'm like, okay, you should be you're probably just only working to enhance the health of men, because I don't see any woman here. And by all means, no man is going to know what women go through. So I think it's very important that the leadership at the highest level, starting from Joe Biden's cabinet member all the way down to what happens at the Congress and what happens at every decision table, should really reflect the people that we serve, and also makes up the society. So it's very, very important that hopefully this is something that the next administration will work on. And I know that it's not going to be achieved in 4 years. It's not going to be achieved in 8 years. I think it's important to continue the legacy. I've cheered, and I have really been very happy with the outcome of the change and the election results. But we all know this is temporary. This is going to need work for the next however many years that we're on this earth. Thank you.
Yes, Trevor.
Yeah, I would just
Good
go
stuff.
by saying COVID, the long-term impacts of COVID, and the lessons of COVID. What has COVID shown us about who we are and who we're not as governments, as regional institutions, the ways in which our funding mechanisms serve us and fail us, the ways in which our political leaders and party systems serve us and fail us, and how to overcome that, right? And so in all of our hubris about our greatness and power, millions of people could lose their lives to something that you can't even see with the naked eye. And if that's not enough to humble you, I don't know what is.
Yeah, absolutely. Wonderful points, all of you. Definitely a lot to unpack again in the next session. And thank you all for joining us. We're going to go to the breakouts.